So I would like to introduce to our speaker. So Mrs. Priyadarshini is an assistant professor at SDNB College in Chennai. She holds a master degree in psychology. She has various journals and books under her belt which has been published in national and international conferences. She is a mentor, professor and a social worker. Such a versatile personality. It's an honor you are addressing this topic to us.
Thank you, Shanes.
Uh,
Thank you to
so
DORAI Foundation once again for giving me this opportunity. So, yes, so that we can start with the session.
Yes, ma'am. So our first question would be if you give us a short intro on liver cirrhosis.
Yes, okay. So, liver cirrhosis is like a chronic liver damage which is being caused from a variety of causes. So, we can see the causes which can also lead to the liver cirrhosis, and it leads to a scarring and a liver failure at the last. So, it is a liver damage which is caused by cirrhosis. That it cannot be undone, but further damage can be limited at the time. So initially, patient may experience fatigue. They'll be so fatigued in nature, and they'll be so weak, and the weight loss will also be will also be experienced by that patient. So during the later stages of the cirrhosis, these patients may develop severe jaundice, which we all know, the yellowing of the skin as well as the eyeballs, etc. And they'll be having a gastrointestinal bleeding and the abdominal swelling and confusion at the last. So, to start with it, we can see few symptoms of uh, liver cirrhosis, where people, as I said before, the liver will get so worse in nature, and they'll be having the fatigue and weakness, lack of appetite. They won't be able to eat the particular quantity of food which they had previously, and due to which they'll be having a weight loss, and they'll always feel nausea. Then the common causes of liver disease is like there'll be like viral. It is being caused most probably due to the intake of alcohol, which means abuse of alcohol. So people who intake alcohol at an larger amount will obviously get this liver cirrhosis, which means the damage of the liver. And previously, again, we can see like it is being caused due to viral infections such as hepatitis B and hepatitis C. So there are hepatitis B is like it is also a liver disorder or a disease. So this can be curable and preventable by vaccines. Whereas hepatitis C is a liver inflammation, and the third cause is like alcohol hepatitis, which we have already seen like it is the inflammation of the liver due to the intake of alcohol, and it is also caused due to genetic factors, and it is also caused due to underlying autoimmune diseases like diabetes mellitus, multiple sclerosis, and rheumatoid arthritis, and few more to mention. And like it is also caused by obese, those people who are so overweight than they have to be. So the obese people may can get this liver cirrhosis, and a poor diet and lifestyle will obviously lead to liver cirrhosis, where the food that we intake is also responsible for the liver's function. So when the food we intake is not good in nature, that the liver cannot make it in a good manner, so the liver may get affected. So the poor diet and lifestyle will lead to liver cirrhosis. And certain drugs and medications and the unprescribed medication that we take apart from the prescribed medications and few chemicals that we intake will also lead to liver cirrhosis. And there are four stages of liver cirrhosis. First stage will be about inflammation. First, the liver will get swollen, and the second stage will be about fibrosis. So as we seen before, it will start like a scarring will be happening in the liver, and third stage is cirrhosis. The scarring will spread over all the overall the liver, and at last it will lead to a liver failure, which will lead to a death of a particular person. Yes.
Thank you so much for the intro. So our second question would be impact of psychological factors on health in patients with liver cirrhosis.
Yes. So any person or any patient who's having any sort of disease will their quality of life. There's a factor like health related quality of life. So how is our health, and depending on it, how is our quality of life? So this should be balanced. So health related quality of life is like the individual perception towards the physical, his cognitive, his emotional and social functioning. So this will obviously get affected by this person living with liver cirrhosis. So they, as we seen before, there will be some abdominal discomfort with these people. They'll not be able to breathe properly. They'll be having increased stress and anxiety related to the body image. So when the liver gets affected, they'll not eat. So their body weight remains so down. So they'll lose their body weight. So their anxiety and the stress that is related to body weight and the immobility and an increased likelihood of falls. So these people, when they doesn't intake, they're having the habit of they'll fall at a time. So they'll immediately fall whenever they hit to some other thing, or they'll get fainted every time when they walk in the sun or whatever it may be. So all these things will have a major impact in their health related quality of life. And yes, first is stress. Everywhere, every time we'll be having stress when we are being affected with some. So it is known as stressors. Subsequently, we'll be calling it as a stressors. So stress is most widely discussed psychological factor in health. So particularly in relationship to the work that we all do. So it is as I said before, it is called as stressors. It is complicated, due to the strong subjective element, but a broad definition of stress that is results from the lack of fitness. So between a person and their world is interconnectable. So when we couldn't get connected to our connected to our world, we couldn't able to go through our daily activities, or maybe getting connected with persons, or staying connected with patients. Everything will be affected. So this may lead to a physical or a mental illness. So next is like all the psychological factors will have some influence in the experience of health and illness. But how we intake, it is known as health behaviors. So how we take care of our health behavior is so important in nature. So first, when we get any sort of diseases, so first the factor that worsens our medical condition, there are four serious factors that is worsen our medical condition. So first is like denying the significance or severity of symptoms. So for example, being a psychiatric social worker, I go and explain to a particular person that you are being affected with liver cirrhosis. So your liver will get damaged in a period of time, in interval of time. This may or may not lead to a death. I'm going and explaining to a particular person or a patient. So first he'll do is like he'll deny that severe symptoms. He'll say like, no, I'll not be having these sort of symptoms. I've been taking so good foods and so good and everything that I take care. So I cannot believe this. So first factor is like they'll deny this symptoms, and then is like denying the need for treatment. So when I'm going and explain that you need to undergo so and so treatment, both physically and mentally, so he'll deny the need for the treatment, and he'll not follow the prescribed treatment plan that he is undergoing, and he'll not getting the recommended test that has to be done and get sorted out for the problems. So these are the impact of psychological factor on the health.
Okay, ma'am. The third question would be depression in patients with liver cirrhosis.
Yes. So as we seen before, stress is first major factor, and second one would be depression. So any person who's affected with liver cirrhosis, they'll be having the depression and anxiety, which is most common in the people. So it is been founded out by the clinical gastroenterologist and hepatology. And one more thing is that we need to note here is it is frequently seen in patients with non-alcoholic fatty liver disease. So there's a we have seen before alcoholic hepatitis, it may lead to liver cirrhosis. And there is also one more disease like non-alcoholic fatty liver disease. This is being caused due to the intake of foods that is so unprocessed in nature, that is so fast foods, and the foods that is being normally not good for all our health. So this depression and anxiety will be presenting in a very critical situation, because they exhibit an adverse effect on the course of illness. These people who are affected with liver cirrhosis will not be able to sleep properly, will not be able to eat properly, or to talk with the persons who are taking care of them or whoever it may be. So they'll be affecting them in a physical symptoms, it will functionally affect that persons, and it will decrease the compliance of treatment and quality of life. So these mental health issues can affect the quality of life as well as, and they'll interfere with the ability to stay on the treatment. So when they get depressed, they'll just deny the treatment plan, and they'll not intake the prescribed medication. So obviously this will lead to a more and more damage of the liver. So like this depression will obviously impair their activities of daily living, which in turn can lead to a low mood for those people. Yes.
Thank you, ma'am. So our next question will be, how does
Strange,
liver?
Strange, can
Yes,
you
ma'am.
give me 5 minutes? I'm getting a call, important call. Can I
Yes,
connect
ma'am.
back in 5 minutes? Five
Yes,
minutes,
ma'am.
okay?
Yes, ma'am. Yes, ma'am.
Yes,
Sure.
yes. Yes, Shane, sorry. Sorry for the inconvenience. Sorry for it. Sorry for
No
it,
worries.
guys.
No worries, ma'am. Ma'am,
Yes,
so we'll resume with a question.
yes, please.
Ma'am, so our next question is, how does liver failure affect the brain?
Yes. So our liver function is like it will filter out all the toxic materials and it will get connected to the blood, and this blood will get flow to all parts of our body. So there is a disease like hepatic encephalopathy. So it is a nervous system disorder which is brought on by severe liver disease. So when the liver doesn't work properly, the toxins get built up in our blood, and this blood will spread out to all parts of body, especially first to the brain, and it will affect all the brain functions. So the people with hepatic encephalopathy, may seem get confused. So they'll be affected with cognitive impairment, like they'll not be having good memory, they'll not be having good thoughts, the behaviors, the attitude they show towards other people, all these things will get affected. So the treatments can make them get rid of the body of toxins and reverse them to a temporary condition. So the disease liver struggles to filter toxins. So normalized, as I said before, normalized liver will filter out the toxins that is available in our food, and it has been the substance that is created from the breakdown of the food or the alcohol that the person intake or the medication and even the muscles. So all these toxins will be filtered out by the liver. That is the normal functions of the liver. So the diseased liver cannot filter out these toxins from our body. So that will make these toxins to get connected to the get imparted into our bloodstream. So these toxins will build up in the body and will get affect the brain function. So up to 50% of the people with the cirrhosis of liver, eventually they'll develop the symptoms of hepatic encephalopathy, because liver cirrhosis is like it is slower damage of our liver parts and the function. So this will obviously make the liver to dysfunction. So it will also develop the symptoms of hepatic encephalopathy. And there are like three types of hepatic encephalopathy. So type A is brought on by acute liver failure, which is so partial, like so mild in nature. So it is like without underlying chronic liver disease. And type B occurs in some people who have a shunt. Shunt is like that connects the two veins inside the liver without underlying liver disease. And next is like type C, which is result from a very chronic liver disease and scarring, which is called cirrhosis, as we are seeing here. And people with people with hepatic encephalopathy will experience impaired brain functions, and symptoms may include like they'll be having very irritability mood, and they'll be having anxiety, they'll be having cognitive impairment, they'll be in a very confused state, they'll not be able to make judgment, all these things, and they'll having a problem of coordination or balance problems, and they'll have a difficulty in concentrating or a very short attention span, they'll not be able to focus anything in their normal living life, and they'll be having mood or personality changes in their normal life, and reduce alertness, as we said before, they'll not be able to focus or concentrate on a particular thing, and sleep problems and slur speech will also be the symptoms of hepatic encephalopathy.
Okay, ma'am. So our next question is how to prepare ourselves psychologically if we are being affected by liver cirrhosis.
Yes. Any person who's been affected with liver cirrhosis will first experience the form of emotions like they'll obviously it will this the liver cirrhosis will obviously lead to a death, but this is not a proper mindset that a person should have. First is the emotion one experience after receiving a diagnosis of liver disease may be difficult to deal with. Any sort of disease, it is like a terminal illness, like a cancer or strokes or AIDS. It is also like liver cirrhosis is considered to be a terminal illness, but the emotion that they experience is not good to deal with. So they may feel very upset, they may feel overwhelmed, and they'll be worried about their future. So they'll not know when they'll sentence to death, or when they'll be losing their life, or how to move on with the symptoms and etc. So as the news sinks in, they may want to share their emotions with some person who's so concerned for them, who's so lovable to them, and who's so close to them. So they'll start doing it, or the particular person should start doing this. So sharing their concerns and talking about how they feel may comfort them first. So we have shared it to some person that I'm having this sort of problem, and the symptoms should also be explained to them, and also they may help themselves to manage their diagnosis now and as well as in the future also. because liver cirrhosis is not that much serious symptomatic in nature, whereas few things like being fatigue, being weakness, not being able to eat properly will be the symptoms of liver cirrhosis. So all these things can be manageable by a particular patient itself. So furthermore, discussing their condition with the people who are close to them can help them to understand some of the lifestyle changes that they maybe need to make it, and also make them to allow or offer support from other people. It is always recommended that that particular patient should get reputable information about their conditions, because getting sort of ideas or unknown ideas or unfit ideas for this liver cirrhosis will not make them curable. Getting and reputed informations like what to eat, how to maintain a liver cirrhosis diet from a practitioner or a general physician will obviously do good to them. So by ensuring that they fully understand their condition, they'll be able to address any concern that those close to may rise. So doctor appointments may also be overwhelming, because they have to see the doctors very frequently for their treatment procedures, or getting consultation about their symptoms, or the symptoms may get severe at times or may get severe so less at times. So all these things should be sorted out immediately with the doctor's appointments, because doctor's appointments will be so hectic, one time they'll be so good at scannings or the imaging that they go do, it is in a proper condition. So when we go at the next time, they'll be saying like liver is getting damaged 1 by 4th or 3 by 4th of previous times. So these things will be giving some pressure or some sort of depression or stress to those people. So the doctor appointments will also be overwhelming. So by taking someone with you who may be so close to you, your family members or anyone, that can help you to filter the information you're given, while also allowing you or providing you with a prompt to remember to ask the question that you need to ask. You may have several number of questions, like a patient may have several number of questions to ask to a doctor, but at that time of visit, you'll be so confused to ask. So these particular patient particular caretaker whom you are taking with you will make you to question them in a sensible manner. So it is also too important for that particular patient to tell the medical practitioner what has happened in the from the previous visit till now. So we must be so clear, and we must give a true facts what is happening in our body, so that the medical practitioner will be able to give a concerned treatment that is particular to that particular symptoms, and they may prescribe medication to that particular patient. So it is very important to be daily supported and listen. So any patient, for any terminal illness patient or very chronic illness patient, will be loved to hear and get support. They'll be talking, however you'll be talking about the disease with your loved ones is not always easy, because when your loved ones listen to all your symptoms or the illness factors, very risk factors, or the pain that you undergone, they'll not be able to listen to you, because they are so close to you, they couldn't able to bear your pain. But you have that particular patient should have to talk to that closed ones, because expressing the feelings or the emotions and the pains will make them to know about yourself and your disease condition. So it is therefore essential to get adapted to your explanation on each person's personality. So then is like thinking about what the reaction might be. Yes, the particular patient should not tell everything that they undergo. They would have they would have blood vomited previous night, but that cannot be told to that particular individual, because they'll get immediate fear. What has happened to you? Previously you were good, but immediately saying that you got blood vomit. So they couldn't able to bear. They'll be so frustrated. They'll be so anxious to. They'll be so worried to know about your particular condition. So you must, that particular patient must choose what to tell, and as a closed one, you will know how that particular particular closed relationship will react to your problem. So you must remember to protect yourself if you feel very vulnerable following your diagnosis, and the particular patient must ensure that they are very confident that patient the patient they like to tell will be so supportive and respect respect you and your condition. So few things that I would say here is they can follow the liver cirrhosis diet. So there are various diet procedures like that the particular patient who is affected with liver cirrhosis should follow, like taking good fruits, vegetables, protein-rich fruits and legumes, nuts, seeds, whole grains that are so good in nature, like brown rice, buckwheat, etc., and heart healthy foods like not taking like very refined oil or everything, but instead they can take like olive oils, avocado oils is also available, and nuts and seeds oil is also available, and beverages can also be taken, herbs and spice can also be taken, and few foods that they can avoid from get in the liver cirrhosis diet is like, this is for I am telling all these like liver cirrhosis diet for the people who are taking care of the patient who is affected with liver cirrhosis. So, like this liver cirrhosis diet should limit the alcohol intake of that particular patient, and they should not consume the food that is so highly processed in nature, that is packed snacks and convenience meals that they have, and the fast foods that they intake previously, and unhealthy fatty foods and salty snacks. Processed meats can be avoided, and high sodium condiments can be avoided, like soy sauce and all type of sauces. Like undercooked foods can also be avoidable, and alcohol, any form of alcohol should be kept away from the people who are affected with liver cirrhosis.
Thank you so much, ma'am, for your for this brief description. So the next question will be, how can we prevent liver cirrhosis?
It is, as we seen before, the food that we intake is the first major cause for the liver cirrhosis after the alcohol intake. So the first preventive measure should be, they should not consume alcohol immediately after the diagnosis of liver cirrhosis. So if they drink more than the two drink a day, or if a man if they take more than what they need, this will obviously affect the scarring. Like we have seen the second or third phases, like fibrosis phase. The intake of alcohol after the diagnosis will obviously lead to an increase in the fibrosis, thereby to lead to a severe inflammation, which will lead to a liver damage, thereby leading it to a death of the particular person. So first, they must avoid intaking alcohol immediately after the diagnosis of liver cirrhosis. And next is like, the particular patient, particular individual, or all of us should not eat raw seafoods, especially the oysters and the clams. So these food will contain a bacteria that can cause a serious illness. The cooked foods, seafoods, is so good in nature, that they contain so protein and carbohydrates and everything. But we should not consume a seafood that is so raw in nature, and we should cut back the amount of salt in our diet. We must and try to get adapted to a food intake, like it should contain reduced salt amount. So like we can use other seasonings to flavor our foods. So next is like following very healthy body habits, like maintaining a healthy weight, and excess body fat can lead to a damage of your liver, as we seen before. A causes, one among the causes is like obesity. So obesity is also a cause for the liver damage. So maintaining a healthy body weight is a good preventive measure. So we must ask, we can also ask for the healthcare providers to give us a weight loss plan, so that we can follow it. And so a particular person is so overweight, they can ask the healthcare provider to give them a weight loss plan. And next is like, everybody should exercise regularly, as we have seen in the previous sessions, like exercising for 20 minutes at least for 3 days in a week will obviously give us a good energetic day in our life. So seeing healthcare providers, like for a regular checkups, will do good. And if you have, or a particular person is having obesity, diabetes, hypertension, or cholesterol related problem, or low good cholesterol problem, all these things, they must take the prescribed medications, like recommended by the medical practitioner. They should be trying to follow all these medication that is prescribed by the medical practitioner. In case if they are not taking the prescribed medication at a particular time, or they're not able to buy it or something or whatever it may be, it may lead to a liver cirrhosis, and this can also be prevented. And quitting smoking is also one more preventive measure. And a healthy liver practice, there are few liver practices that we all need to do, is like avoiding high risk behaviors that can lead to a very infectious disease like hepatitis B, hepatitis C, such as sharing needles for illegal drugs use, or having unprotected sex. So all these things will lead to hepatitis B disease and hepatitis C disease, which will again lead to a liver cirrhosis, which is a liver damage. So this can be avoided. And getting vaccinated against hepatitis B is also must for everyone. So if a particular person is already having a hepatitis, they must ask the provider of your particular either to give a drug treatment for a appropriate to it. And we must get our annual flu shot again. And if you have a pneumonia vaccine to be taken, and make sense of it that you take it in a proper at the proper time. And we must avoid the non-steroidal anti-inflammatory drugs which is so available in nature, and these drugs can cause or worsen your liver functions. And particularly common for everyone, we must take medications and keep all appointments as recommended. We should not take medications that is not being prescribed by the doctors, because any medication which is not prescribed will obviously lead to a liver damage that is not being accepted by the liver, so it will obviously lead to a liver damage. So when that liver doesn't able to filter out the toxins that is being present in that particular medications, obviously these toxins will get injected into our bloodstream so that it will affect our brain, and this will lead to a liver cirrhosis. So more than this, there are various healthy foods that we have seen before: taking good fruits, vegetables, good protein rich fruit, legumes, nuts, seeds. So at this technical era, or like I can say like fast food eras, so it is quite unseen in people following a good healthy habits. But this has to be enhanced at least to the next generation, so that those people will get curbed from getting all these liver cirrhosis or any sort of chronic illness. So these are all the preventive measures of getting affected from liver cirrhosis.
So, ma'am, last question for the day would be: it's a prejudice in general community that cirrhosis is synonymous with alcohol. What can be
Yes.
done to change this perception?
Yes. 90%, there it is findings that 90% of liver cirrhosis is caused due to alcohol. But any you can think as an individual, we can think like when a particular person is coming and saying like my liver gets damaged, we'll be think like it is a common stigmatized statement, like when your liver gets damaged, it is all because of alcohol that you intake. So it is quite common in either, but it is not true, because alcoholic hepatitis or liver cirrhosis is quite common in people who are not alcoholic. Also, it is being caused due to various autoimmune diseases like. As you've seen before, rheumatoid arthritis, multiple sclerosis, diabetic mellitus will also, all these medical conditions may also lead to a liver cirrhosis. So people vary greatly in the way their liver reacts to alcohol. So alcoholic persons are more prone to liver cirrhosis, whereas people who are non-alcoholic will obviously so not more prone to liver cirrhosis. Hepatitis is like an inflammation of a liver, whereas alcoholic hepatitis is like it is it is due to the intake of alcohol that they take. So there is a factor like there is a disease like non-alcoholic steatohepatitis. So it is a condition in which the liver will contains extra fat and they become inflamed. So you have said like it is synonymous to a alcohol intake, but this is not true. It is also caused due to the food that we take. So we cannot relate like when a person intake alcohol, they may or they should. They'll be lead to a liver cirrhosis. This is not a good statement. Whereas there are also various underlying causes that may potentially lead to the liver cirrhosis, like hepatitis B, hepatitis C, genetic factor. So when my previous generation people, if they had a liver cirrhosis, I may have a chance of getting liver cirrhosis. And immune diseases, obese people, so those who intake so fatty rich food, cholesterol rich food, they may get obese, so that liver will stop functioning, like filtering out the toxin that it has to be filtered. So that will obviously lead to liver cirrhosis. And poor diet, lifestyle, and the drugs and the medication that we intake, which is not being prescribed by the medical practitioner. So liver cirrhosis is not only due to the intake of alcohol, whereas there are various other factors that is being related to the cause of liver cirrhosis.
Thank you so much, ma'am. Now, I would like you to announce the winners of the quiz of juvenile diabetes, which this was the session held yesterday.
Yes, yes. So previous session quiz winners, like a third prize is for Gayatri Damli. So congratulations Gayatri for your winning. So second is like second prize is backed by Aditya Deshmukh. Congratulations Aditya. And first prize is Ashay Gotke. So congratulations to the winners as well as for the participants.
Ma'am, as a vote of thanks, I would like to say a few words. Thank you so much, ma'am, for an informative session. It has been such an honor to be part of this wonderful event. On behalf of the organization, I would like to extend my heartfelt gratitude to our esteemed guest, Mrs. Priyadarshini. I would like to thank all of you that are present here for making the time to be with us today and helping us make this event a grand success. Thank you, one and all.
To quote here, I am not Mrs. I am Miss Priyadarshini.
Yeah.
Okay,
Thank you
Miss
for
Priyadarshini.
thank you for it. Thank you.
Thank you so much,
Thank you,
ma'am.
So much,
Saint.
ma'am.
Ma'am.
Thank you,
Thank
Animesh.
you, ma'am.
Thank you, ma'am.
Ma'am, let me take
Thank
a
you, everyone.
yeah. Can I take a
Yes,
screenshot?
yes, yes,
Yes.
please.
Rahul ले ले भाई.
Okay. Yes, ma'am. Took.
Thank you so much, ma'am. Thank you so much for joining.
Thank you, Animesh.
Thank
Thank
you.
you, everyone.
Thank you so much, ma'am.